Hi, my name is Shastri. I run a pharma firm. It's a drug design molecule firm. And I have over 300 molecules which are ready for clinical trials. And most of them are anti-cancer, some are anti-HIV, and some are for Alzheimer's disease. And most of the graduates after doing pharmacy or maybe higher education in medicinal chemistry, they go for either teaching line, industry, or maybe some other field in pharma. There are at least 15 fields in pharma, which I don't think I need to elaborate. But I decided I want to go in drug design because I may have something which others don't have. And over the years, in the past 10 years, I created many molecules which are useful. In terms of clinical trials, they are ready, which need to run a trial through a firm which already have established. In India, the pharmaceutical market in terms of drug design is very small because there are not many players in this field. Like there are IITians who are doing drug design, and there are NRIs who came from America, UK, Sweden, Austria, some of the best countries to be in this field. But the niche is huge. If you just look at the starting investment, that is 1 crore just for one software. So if there are 3 scientists in this field, then you need 3 crore just for for 3 people. And then if you look at the next phase, say you want a clinical trial, that is 85 lakhs for just one phase. And that's one first phase that is not animal trial, that tissue trial. Animal trials and clinical trials, then the first final human trials. So in terms of investment in a pharma firm, you can say about 25 crore is the minimum required just for the molecule to come into a small case where, okay, you can say that this molecule is ready. So that's why many are not in this field. I am in this field because I feel I can do it. I have already done it. In terms of side effect removal, I have done everything. My molecules are, say, when you look at a drug score, you can range from 1 to 5 in terms of solubility. In terms of, in terms of other things, like say enzyme inhibition. There are 5 kinds of inhibition. In all these fields, I have a score between 1 to 2 and to 1.5 to 3.5. And when you look at the current medicines which are already existing for cancer, HIV, others, the maximum score I've seen is to 2.5. I can offer 3.5, which no one can answer. I'm saying not with this because of some kind of ego issue. I'm saying because I've seen it. You take any molecule, you put in the software, it'll show, okay, this is 3.5, this is 2.5, but you won't get it. I can offer it for between 1.5 to 3.5, and I'm sure nobody can do this. Now, if you see why investors should show in my company, JaysMedLabs. Thing is, like other people, I have faith in myself and the faith that the molecules I'm designing have shown in house ability to cure disease. I have used 2 molecules to cure cancer, and there are 2 patients which I can show data at a later date. But in terms of molecules, 3 molecules are ready. When I'm saying ready, it's ready. I can show it to you anytime. For that, I can show 3 screenshots which shows that, okay, the scores which usually are high for molecules are shown. There's no problem. And main thing about other companies is that, okay, nobody can say, okay, I have 10 molecules, 100 molecules. Now, thing is about pharma design is that you can have any molecule which can be in terms of druggability score high, but something can go wrong. But I have taken all those into consideration that no, my molecules may not go wrong. They may chance, but that chances compared to other companies are low. And then there is something called, people face stagnation. Elon Musk faced 5 years stagnation before he actually made big in Tesla rockets. And I have faced same issue. I'm in the next Elon Musk. But unless you are ready to face stagnation, ridicule of friends, your family, who said, okay, this won't work. No, I believe it will work. But that's how business goes up. If you don't have faith in yourself, it won't work. So I can show molecules from the final stage to the last stage. Most companies or most scientists have at least 3 scientists in them just for one phase. I can do clinical trials, I can do drug design, I can do pharma regulatory, anything, because I have studied all the subjects all through the years. 2004 I passed out from my medical college in Madras, and since then I'm in this field. I have worked as a representative, I have worked in pharmacy, I have worked in, you can say, as an area sales manager. But all through these years, I have been working towards these molecules. 2009, I decided, okay, it's enough. I will fully jump into this field. Thing about investors is that they want profit. I can offer profit, but I won't say, okay, I'll give $1 million from the word save or go. No. For initially, we can expect that small molecule firms will be profitable, but we had to invest from the beginning, and then we had to hope that someone will come and take it from me. Now, as I said before, we have 300 molecules, and I am the only company who can say I add molecules every week. When I say every week means every week I add maybe 50 to 100, because every day I am in my office, in my lab, doing all those things, making sure I have all the parameters right, all the druggability characters right, all the BBR molecules right, everything. So in terms of what investors are looking for, best thing will be for anyone to look for companies which have molecules which can be used for curing diseases. I have made sure that all these molecules can be immediately brought into the clinical trial. I need just the right kind of investment which can be used for the final phase. When I say final phase, not the clinical trial phase, I am saying the final phase of presenting molecules to the buyer. There are companies which buy from small molecules firm like me. Okay, they buy it and then their own clinical trials, then they sell it to the main buyer. So we can do that. My conviction is high, and the investor should show faith in me, in that nobody else can offer the molecules which others can do. As I said before, every week I'm adding molecules, and investor will be interested in someone who is actually doing something which no other is doing. And in terms of what he wants, I can do it. Now, if suppose you want 20%, we can work it out. It's not an issue. And then there are issues like investment per year. Yes, usually it's not much, but initially when you start investing 1 crore, expect investment from the beginning and returns from the beginning. But I can say it will take at least 6 months to 1 year to actually become profitable, maybe more. But I can say in the long run, my company will be the best in terms of returns.